The IROC Spirometry training course is aimed at clinical Indigenous health workers and nursing staff who are interested in doing lung function testing in their workplace. It's a 2-day training course, and what we're teaching is a particular breathing test, and it can be used to assess patients and their clients and their lung function. So, as I said, the course is run over 2 days, and we will run the course anywhere in Queensland. So we will come to you if you have a group of people who are interested in doing lung function testing and spirometry, then we will come to you, so contact us and we'll come to you. The course is free, so we only we provide both learning materials, and we also provide meals, that's morning and afternoon teas and lunches as well. And we encourage people to bring their own spirometers if they have them. And if you don't have one, we can actually provide them for the learning over those 2 days. A fun environment, we try and make it as enjoyable as possible, and there's lots of participation. We also provide flights and accommodation, and we can book these for you if it's required. You'll learn how to use a spirometer, how to do spirometry on clients, and how to interpret spirometry results. All your spirometry needs in one handy course.
Don't take our word for it. Here are 2 participants, Tamika and Bonnie.
Considering that we're health professionals ourselves, we find it very, very useful to actually understand what we're actually doing now as a spirometry test.
To be able to take that knowledge back to work and inform the doctors and everyone else that now we can do a spirometry test, know the contraindications and the indications, and take it all back to work is
And knowing exactly what we're talking
very
about.
valuable. To know that you can do a spirometry test and anyone can follow the instructions on the computer, but to know that this is acceptable, this one was a dodgy blow, those false results can then impact people's lives. Knowing how to do it right, how to interpret it, and how to tell the doctor, this is a good acceptable test and these are good results or whatnot.
It'll give us a better outcome for our Indigenous population, I think.
Absolutely.
Yeah, definitely.
How about we hear firsthand from our trainers, Leanne and Margaret.
The spirometry test is a lung function test which is really helpful for assessing patients with breathing difficulties, and it's particularly relevant for smoking-related lung disease, which is very common in the Indigenous community. The problem is that many of the people that do the test in primary care haven't been properly trained, and so when they give the results to their doctors, the test might not be validly done and the results might not be meaningful.
The main thing we hope people walk away with is a feeling that they are confident to do the test, that they feel that they've had an understanding of what the results mean, and also that they've had a good time as well, a sense of fun. So we hope to give people an informative 2 days, but also it's been a fun learning environment. We also encourage people to bring their own spirometers along so that when they walk away, they feel confident that they can use their own spirometer.
We provide support after the course. We provide our phone numbers and emails, and we welcome participants to ring us with any queries they do have. We also ask and require actually that participants submit spirometry tests that they have done, and we can give them feedback on those tests.
The Indigenous Spirometry Training Program is provided through the Indigenous Respiratory Outreach Care Program, a statewide program and an initiative of the statewide Respiratory Clinical Network, Queensland Department of Health.